This is a dental implant that we did to replace a lower first molar that had been giving the patient problems for a number of years. Here's the tooth in question. It had always been painful to bite down on. It had a fistula that would come and go, and there's a radiolucency around the mesial root. So talked about options, and the patient decided they wanted the tooth replaced with a dental implant. We removed the tooth and then placed a allograft infused collagen plug as a socket preservation. Waited 4 months, and then we're going to go back in and place the implant. I like to start with a 5mm tissue punch over the ridge where I want the healing cap coming out of. Remove that soft tissue with a curette and then lay a small buccal flap with a 15 blade. And reflect the flap with a molt periosteal until we have good visual access to the buccal bone. You can see we have a good platform of bone to work with here. So we're going to remove some soft tissue and then go in and place a little dimple right in the middle of the tissue punch before going in with our pilot drill to get through the cortical bone. And then we're going to go in with our first osteotomy drill. This is a 2mm Densa drill. We decided to place a 4.8mm diameter tissue level implant in this case. And once we have our 2mm osteotomy drill almost to length, we're going to take a pilot PA to verify that we have good angulation. And then we're going to go back in with our osteotomy drills and prepare the osteotomy to length. Typically prepare 1 or 2 millimeters deeper than the length of the implant that we plan to place. And we're going to widen out the osteotomy preparation here. This is our final osteotomy drill, a 4.5mm diameter Densa burr. I'm going to irrigate the osteotomy thoroughly with sterile saline before placing our fixture. Going to use our implant handpiece to place the fixture mostly to length. And then we're going to torque it down the rest of the way with our torque wrench. We had pretty good primary stability in this case, as we often do for mandibular bone. Going to get an ISQ reading with our Ostel beacon here. And then we're going to irrigate the site with sterile saline once more and then place our healing cap. Typically torque my healing caps down to 10 or 15 Newton centimeters, and then I like to reapproximate the tissue flap with a tissue adhesive here. Going to give the site about 3 months to heal before going back in and restoring the implant.